You know, that kind of leads on to the next question, and I'd love to get your experience on this. You know, 2009 to now, what's the biggest sort of differences that you've seen in terms of, you know, as we say, tackling the stigma and mental health in general?
Oh gosh, I mean, there've been lots of changes, Paul. I mean, I suppose the key one at this end of the campaign is the fact that public figures like members of parliament, it's probably about 5 years or so, stood up in parliament. And I think it might have been a Tory actually was the first one to sort of stand up and say, I have a mental health problem. And it was a bit like I Spartacus, because suddenly, you know, a Labour, you know, member of parliament stood up, and then you know, a Liberal, and then another Tory, and then another Labour. And it was, but that was amazing, the fact that they could do that. This is about, it was probably about 5 or 6 years into that Time to Change being active, and sort of really working with all sorts of different people to really sort of be open and talk about their lived experience. And then, of course, in the last couple of years, you know, we've seen the likes of Prince William and Catherine, Meghan and Prince Harry actually talking about their own mental health issues. And I can guarantee in 2009, there is no way that a senior member of the royal family would have shared their most intimate mental health issues with the world, let alone with the nation. And I think that has been a dramatic turn of events. However, it comes with a caveat, which is, if it wasn't for people like you and the thousands of people that I've had the privilege of working with in Time to Change, you know, people with their own lived experience, who we work so closely with to sort of support, coach, I suppose, to a certain degree, certainly train people to empower them to have the confidence to speak up about their mental health, sometimes to complete and utter strangers, and the types of events that I would organize, where, you know, we might be in a festival, or we might be in a high street, or we might be in a shopping center, where, you know, people with mental health issues are actually engaging with the public, who don't know when they first see all these people in t-shirts what it's all about, because they think it's some kind of fun fair or something for the kids, because, you know, we'd make it really jolly and positive and hopeful. But once they got talking to people with mental health issues and they just shared a little bit of their lived experience, we know that that had a profound effect on people, because Time to Change is exceptional in how it measures the impact of the work that we do. You know, we would go back, you know, we would question people, you know, we had evaluators who would go and question people about that experience you just had talking to somebody. And then the evaluators would follow up in 3 months' time and 6 months' time to see how behavior or attitudes had changed. And so, you know, if you look at the vast amount of research that Time to Change has done, you can actually see where the increase has been. So much so that, you know, somewhere almost like 6 million people's attitude has been changed, and consequently their behavior over the last decade or so. And that, for me, is the most remarkable thing. But, you know, I have to congratulate our champions, because if it wasn't for ordinary people speaking up, you know, you wouldn't have the business leaders, the politicians, members of the royal family actually being so open and honest about their own mental health issues. So, you know, I would always congratulate and thank the thousands of Time to Change champions that I've worked with, because they're the ones, they're the driving dynamo, the energy behind this social movement, and which has made the change that we're all benefiting from now, because so many more people are talking about mental health issues.